Geoffrey Macho, the Member of Parliament for Busia Municipality, has urged the government to support the newly established Shine Outreach Hospital to provide free medical services in the area. During a meeting with the Busia District Health Council, Macho, a director of the hospital, emphasized that they cannot offer free services without government support, which would allow them to access primary health care funding. This initiative aims to reduce the tendency of residents seeking medical services across the border in Kenya or traveling long distances to other cities.
Easy to run a hospital without support of government. And that's why I want to thank Dr. Macho for the help. We need you to help us come into like COVID, so that it is funded, so that we are part of you to supplement the government to help our people get treated. In my prayer number 2, I pray that you help recommend us and approve us to be beneficiaries of primary health care grant. That grant will help us a lot, majorly to have community outreaches, immunizations, family planning, and also other activities that can help the hospital give services to the people. Then the third prayer, this one I will put it purposely to Dr. Panyako. We are praying that you bless us with the recommendation so that we can be part of the Uganda Medical Protestant Bureau. Because when you are part of that bureau, it helps you. You just order medicine from joint medical stores, they treat your people and you pay. Secondly, when you're part of that bureau, they train your people with Uganda Medical Protestant Bureau. They help you to train your people, because we want to turn this to be a center of training, refresher training for medical people and even leaders on health policies and VHTs and others. Then, on addition to that, to Doctor, we pray that you recommend us to be a blood banker center, so that we can be able to give blood to our people, because most of them are running to Dr. Were's medical center in Bugiri. But I believe when we get enough blood here, we can supplement and give our brothers and sisters in Damani, Masafu, Nebula, and other areas. Because we are losing so many mothers in this region because of something that is there. And we have capacity, because even in our architecture plan, we have a special room specifically for that purpose. Lastly, Madam Chair and the colleagues, I want to inform you that the journey you have started today, we are committed to move with you people as a council, as a committee, and even as a council. And even we are committed to move with the Honorable Councilors by God's plan if those who did not go back. Why? Because this hospital, we are putting up a community insurance scheme that somebody will be paying like 400 or 500,000 and he is treated a full year on that money. You just come with a card. You just come with a Shine Outreach card and you are treated on that money for a full year. And when we shall say 500,000 or 400 or 300, You don't carry 500,000 here, no. You bring 10,000, 20,000, 30, 10, 50, 70, until the year gets finished. Why are we doing this? We are seeing so many people die in homes because they have no money to go for treatment. But any little you would have paid, you just come for treatment, you keep topping up. Madam Chair and honorable members, together with the DHO, I want to say that Mayingo district has committed that all teachers are going to sign with us that contract of community insurance scheme. And when we are addressing teachers, every teacher wants to join it. Bugiri, the same. Busia Municipal, the same. The only challenge we are having is that now the community wants, everybody wants the community insurance because they see.
Helen Nekesa Bali Kudembe, Topi Auma Aguba, the chairperson Busia District Council Social Service Committee, and Anna Mary Nabwire, among other councillors in the Health Committee, said that they want to ensure there is improvement in service delivery and are going to continue advocating for government to give Busia priority.
Also, those who have been moving from here to Kenya, now they are getting services. Services have come nearer to the community.
Okay.
As committee, we shall go back, write a report, make a recommendation to council, and then council approves and pronounce itself on it and comes council resolution for implementation. And as committee, we shall make sure and we shall give total support to ensure that the facility gets support, gets PHC funds to enable it to run these activities well.
In fact, first of all, I will talk about accessibility. They have put in place the ramps to enable persons with physical disability to access the services, which has been so good because we have been involved in the services that are taking place. Then in maternity, there is a adjustable bed. When a lady comes who has a disability and cannot climb, they will just adjust the bed and we accommodate her. Also, the part of orthopedic is there to cater for people with physical disabilities.
And also beneficial to the hospital because we are going to take this information outside to the community because some of us didn't even know. So we are going to take it to the community. We are going to put it in our report to council. Even the prayers which the director talked about, put them on council so that council can pronounce it. So because we've been partnering with these hospitals, time memorial, and they are getting PHC. So for us to ask the resolution, now it is upon the people who are up to make a follow-up to ensure that it is implemented. But otherwise, we appreciate. We appreciate. Yeah, we appreciate so much.
Madam Chair and honorable members, Shine Outreach Hospital is a non-profit, faith-based private hospital located here in Kisanya B, in Western Division of Busia Municipality in Busia District. This hospital, we started it as a vision to supplement the government services of providing quality and affordable health care to the vulnerable people in Eastern Uganda and Busia in particular, even the Western Kenya too. We are a 100-bed hospital with all functional departments, as Dr. Sise will brief you when we are on the tour. And we have a staff of 40 people. In the staff of 40 people, we have 2 permanent doctors. We have MS, Dr. Kuchalis, Dr. Kuziwe, who is a doctor of internal medicine, and we have Dr. Runji Sise, who is a general doctor, but we have 6 visiting doctors who come to visit in all departments. We have a team of six midwives, and we have 8 nurses, and we also have people of specialized areas like orthopedic. We are happy that we have not stayed long when we are giving our health services to the people, but the reception in the community is very, very good. That right now we are addressing a big number of mothers, maternal cases, and we see that mother and child care department is one of the key that we are handling, and that makes our dream to come true, because our vision was to make sure that children and mothers get equitable, affordable services at the time that they want. At the same time, all departments are functioning, but we have clustered the hospital in 3 phases. The first phase, we started with OPD and some in-service for specialized cases like mothers and children and men of agency. We have our pharmacy functioning. We boast as having one of the best labs in the region as per now. We have also set standard for the radiology department, that we have the best ultrasound machine, the latest. In fact, there are 2 in the country, here and Mengo. We have the latest ultrasound machine that even does cardiac tests. And we are getting referrals even from Bali, and many hospitals of Western Kenya are referring here. So that gives us an advantage to be a hospital that has come with services that have not been here. Our target area is big. We are expecting to handle a target area of almost 4 districts: Busia, Namayingo, Tororo, and Ugiri. And truly, among the elders who come for consultation, we are getting majority from Ugiri. As a hospital, we have come with an approach that is outreach, community-based. Community-based outreach is that we have put up friendly costs that even a poor person can come and get the treatment. Therefore, we are happy to let you know that through the support of the district.
Matthias Wabwire Panyako, the Busia District Health Officer, said that health services are a key factor in the community. They are working together with both government and private health facilities to ensure good health service delivery in the area.
Was to recommend him to the Protestant Medical Bureau so that he can be affiliated to it. That's one of the requirements in case he's successful. It's one of the requirements that Ministry of Health wants. But key to that process is your recommendation, your resolution actually, the resolution of council. So you have to, if you are to help Shine Hospital, you have to pronounce words about it, and then that will also be required if one is to be assisted. Much as it is a private hospital, but they do work for the government. They are doing their work as a district, and all their data which is generated is our data. All the people whom they take care of, they are our people. So we have tried to, we are working hand in hand with the administration to make sure that they attend to our people at a lower cost. And there are services like immunization. Those ones we can come in even before Ministry of Health begins giving them the other support. Things like the vaccines, because those ones we can keep and then we demand for accountability. Plus the data which we generate and to put in our system. So I would want to assure the ED and your team that as a district, especially after this committee has come here to see what you're doing, as a health department, we shall give you all the support that we can give within our mandate. I'm sure I've not seen any frowning face amongst the team which I have escorted. So I'm also thinking that their recommendation would be good. When their recommendation is good, it also gives me a boost to give further services to you. Otherwise, I would like to thank you very much, Honorable, because what you've done in this place, it is not something which is done by a faint-hearted person. Like I was telling one of the Honorables that medical business, as they call it, it's not a lucrative business. So it requires a lot of investment with very minimal return. And in most cases, many people who are ventured in there, you find them trying to struggling a lot, even to make the first birthday, because the need is too much, and you already remember you are dealing with people who have problems. For us in the medical field, we deal with people who are problematic. Someone who does not have, somebody who is sick, people who are sick and they are not able to work. These are the people we deal with. And therefore, that's why the government decided to say that we can give a hand to make sure that when we start an initiative like this, it does not end on the way. So, honorable members of council, of committee, I think for us as a department, we are satisfied with what is taking place here. And we shall be following your recommendation after here to see that we support Shine Outreach Hospital. Thank you very much.
Area, all cases. We have the laboratory services which we shall be running, chemistry, blood smear, electrolytes, like almost everything. Yes, we also have the procedure services like operation, cesarean section, general surgeries, anything like operation, because our theater now is operating. Yes, we also have maternal services for maternity. We have antenatal care services, delivery. We have immunization in pediatrics. Yes, we are offering almost everything. Radiology, for now we are having ultrasound scan, but anytime soon we shall be receiving our X-ray machine.
Helen Nekesa Bali Kudembe, Topi Auma Aguba, the chairperson of Busia District Council Social Service Committee, and Anna Mary Nabwire, among other councillors in the Health Committee, said that they want to ensure there is improvement in service delivery and are going to continue advocating for government to give Busia priority.
This hospital is addressing helping our community. Also those who have been moving from here to Kenya, now they are getting services. Services have come nearer to the community.
Okay.
As committee, we shall go back and write a report, make a recommendation to council, and then council approves and pronounce itself on it, and comes council resolution for implementation. And as committee, we shall make sure and we shall give total support to ensure that the facility gets support, gets PHC funds to enable it to run these activities well.
In fact, first of all, I will talk about accessibility. They have put in place the ramps to enable persons with physical disability to access the services, which has been so good because we have been involved in the services that are taking place. Then in maternity, there is adjustable bed. When a lady comes who has a disability and cannot climb, they will just adjust the bed and will accommodate her.
Nnyo ngaffe abakyala tubadde tuddukira nnyo emasaafu nawe ku Red Cross naye tusangayo ng'omujjuzo mungi nga twenyiga kati waneeno akasente ke katono akawano ng'abakyala ke tusasula tulyoke tufune services ate services si abalwadde bokka n'abaana baffe nabo balifuna emirimu era nsaba ne bahonorables abalala nabo abali wabweru nabo batukolera ekintu nga kino batuteekerewo facilities abaana baffe basobole okufuna emirimu.
Njagala kwebaza nnyo Honorable Macho olwa development gy'ataddewo wano mu Busia yaffe era ffe olwaleero tuli basiibu nnyo era tusiimye nnyo okufuna omukisa ogw'amaanyi okujja wano ku Shine Outreach okulaba kiki ekigenda mu maaso. Tubadde tuli bulira buwulizi era nga tuyitawo buyisi naye olwaleero tuzze wano eno okulaba kiki ekigenda mu maaso na biki ebikolebwa mu ddwaliro. Era nga bwe tuzze wano bye tubadde tetusuubira nti weebiri tutegedde nti weebiri era nga ngamba abantu banaffe bonna abana Busia n'ebitundu ebitotoolodde nti mujje wano eno ku Shine Outreach services weeziri era nga kasente katono nnyo nti n'omuntu omwapo owa wansi ddala abasobola okufuna services. Era ffe nga Social Service Committee okuva ku District Council tweyama nti tujja kuyimirira wamu n'eddwaliro okulaba nga tuliyambirako oba tukola ebisaanidde eddwaliro lino lisobole okuba nga likyagenda amaaso okweyongera okuyamba abantu abawansi.